Thank you for staying with us. Dr. Innocent Orji joins us this morning. He is National President, Nigerian Association of Resident Doctors. He's also Senior Registrar, Orthopedic and Trauma Surgery. Thank you so much for joining us this morning.
Thank you.
Well, following, up with that conversation that your association already had with the Speaker of the House of Representatives, and then this declaration, even before any response from the Speaker or from the House of Representatives about their meeting or none with the President. There are those who wonder, maybe you've received some communication from the Speaker or from the Presidency that you thought wasn't sounding like what you wanted to hear, so you want to call out a strike first? Or?
Well, thank you for having me. It's unfortunate that we have come to this point again. You will recall that we have been on these issues for so long. From January this year, we have been talking about some of them who we believe are actually urgent matters. And ever since then, we have had several engagements with so many government officials. It has been promises upon promises. Sometime in April this year, we had cause to issue an ultimatum on these same issues, and then had to even embark on a warning strike in May. During that strike, we were called, and a memorandum of understanding was signed between us and the government side. Many of the issues that led us to that warning strike, they put timelines to them. But unfortunately, all the timelines has passed, and we kept reminding the government side, and nothing happened. So our members just feel that, look, they are tired of these promises. We actually appreciate the Honorable Speaker for intervening. We also appreciate the Secretary to the Government of the Federation, who also called us last week, and we had a discussion. They say we should give them a day or two, which we did, and nothing has happened. And I want to say that some of the problems we have highlighted can be resolved in a day or two. And so when an association makes demands of government, if you have it, and government is able to resolve two, of course, it gives you hope that they have started attending to your problems, and then there won't be any need to embark on strike. But all the demands we've been making, nothing has been addressed. Okay. Nothing at all.
Okay, well, that's cheering, but just one moment, Bukola. So you notice that, in speaking about the interventions so far, you've spoken about the head of the House of Representatives, is the deputy chairman of the National Assembly itself. And you've also spoken to a former Speaker of the House who occupied the same space, who is now Chief of Staff to the President. Is there anyone you are speaking with in the Ministry of Health, seeing that there is no minister in place?
See, I want to draw the attention of Nigerians to the requests we've been making. Let me give you an example. One of the most important requests that we've made is for the government to release the circular on one-for-one replacement, because our hospitals are depleted. We have been singing this like a song since last year. Government on its own, I'm coming to your question. Government on its own set up a ministerial committee that came up with a guideline on how to quickly replace those who have left the system.
This was when?
February this year. But up till now, it is yet to be
but a minister was
secularized.
A minister was in place at the time.
It has left the Ministry of Health. It is now on the table of the Office of the Head of Civil Service of the Federation. Okay. That circular is yet to be. In fact, in the MOU we signed in May, I have it here, I can show you. They said that on or before 5th June, that circular will be released. And our members are dying because they are overworked. They are breaking that. We lost a doctor last week. It has now become a weekly affair that you wake up every week, you hear that a doctor has died. It's because of stress. And our members just feel that, look, we cannot continue to operate like this. There is nothing, and this issue will not need any money, any financial involvement. What the guideline simply says is that get a list of those doctors who have left the hospitals and replace them.
But Mr. Oji, don't you think there's a limitation on government in that regard? Because where are the people to recruit? A lot of doctors have left, and they're leaving daily. Have
they released the circular? Let them release the circular, and then when I get to the point of say, okay, we have advertised and there is nobody to be recruited. Let them do. We are aware that doctors, so yes, I agree with you, that so many doctors have left. But we still have those who are outside the system who want to come in. And the fact that you are not even bringing them in is making some of them to also leave. So it is worsening the brain drain we are talking about. So many of these issues can be resolved. Incidentally, even the Memorandum of Understanding we signed 2 months ago, if you look at those that signed it, they are all permanent secretaries, and they are still in this.
Okay.
And closely related to that, sorry, Ayo, is your request that they should stop the downgrading of the MDCN. Don't you also think that that is to check the brain drain? You know, government is helpless as it is now with the mass exodus of medical practitioners, not just doctors, but also nurses from the country.
It will be unfortunate if that is the reason, because what it simply means is that you are reducing by certificate the level of training we are getting because you want to check brain drain. That will be very unfortunate. But incidentally, we have been talking about this since last year, and nobody has come out to tell us the reason. I mean, you see, what pains people is that you make demands, you write, in fact, we've even written severally, at least to have a discussion with the MDCN. Let them tell us why this has happened, because it's possible they will even give us the reason and we will understand.
Okay.
But what we are hearing is silent. We are not hearing anything at all.
All right. Our colleagues in Abuja would also like to join in on this conversation. Go ahead, guys.
You know, Dr. Oji, one of the questions that has been bugging me, and I'm sure a lot of other Nigerians, is the fact that, yes, you had this agreement with the federal government and you've had negotiations, you've pursued it over and over again. But the times have changed. And so Nigerians will want to know why you want to add extra pressure to their lives, so to speak, by demanding that government sorts out the agreement you had with them. I'm not making light of that agreement, but let's look at the situation on ground. Is there no way the doctors, the resident doctors, can also consider the situation on ground? Say, okay, government, we know this is the situation, this is what we're willing to do. Have you considered that?
The situation on ground is actually part of what is making us to take this route, because I did tell you that we don't have doctors and nurses in our hospitals, and nobody has been able to disprove that. In fact, even Nigerians who visit these hospitals, they know they are witnessing the increasing waiting time. They come to the accident and emergency department with trauma cases, and you have just one doctor, so they are already dying. And we have been on this for several months. These things can be resolved. People are already dying. Our members are dying. Nigerians are dying too. People are breaking down. So do we rather continue to just let them die, or do we intervene at this point? You see, these things can be resolved. Let the government address the demands we've made, and we will come back. Honestly, nobody wants to go on strike. Let them work hard to resolve these issues, and there won't be any need for any strike action.
When you say resolve these issues, I'm trying to look at them. So you say immediate payment of the 2023 MRTF, immediate release of the circular on one-for-one replacement, payment of skipping arrears, upward review of CONMES in line with full salary restoration to the 2014 value of CONMES. These are your demands. Payment of the arrears of consequential adjustment of minimum to the omitted doctors, reversal of the downgrading of the membership certificate by MDCN, payment of MRTF new hazard allowance, skipping and implementation of corrected CONMES in state tertiary health institutions, payment of omitted hazard allowance, arrears. Dr. Oji, nobody, I'm not sure anybody in his right senses or her right senses will want to look down on any of these demands that you have put out here. But I asked a question earlier, and I'll say we'll go back there again. All these payments you're asking, is there nothing that your organization can do?
Well, I don't know what you mean by is there nothing we can do. Like, we can actually decide to take those demands one after the other. If you take...
Let me put it this way. So, which of these demands, I read out at least 8 of them here, which of them would NARD consider as, okay, if this is taken care of, will be willing to come back and then begin to discuss how the others can be taken care of. I do understand that sometimes government has agreements and they do not keep their own side of the agreement. And so the next thing is the affected body or association takes on the hard road, which is going on strike. But the effect also, which I know that you guys are not happy about, the effect on the Nigerian citizens that need medical attention is there as well. So which of these demands would you say, okay, look, government, if you guys will do this or are willing to sit down and do this, then we'll be willing to come back?
Well, I believe that what happens when an association raises an alarm or makes demands of government is for government to sit down with them and address, if you have 8 demands online like you just listed, and government ends up addressing 1 or 2, and then appeals to you to give them more time and then put timelines on others, of course, discussion can go that way, and there's no way, if that has happened, there is no way we would have come to this point. But I just told you that all the demands you just listed, none has been met, and we have been on this since last year. In fact, for some of them, we have been on them since 2014. Okay, so I have mentioned one of them. Recruit doctors and nurses to replace those who have left the system. Our system is depleted. Our doctors are dying. They are breaking down. They are having burnout effect of the brain drain. It's a very urgent demand. And our members are saying we cannot continue to wait any longer, and every week we'll be having deaths being reported across the country. The 2023 Medical Residency Training Fund that you talked about is captured in the 2023 budget. It is there. So our members are wondering why it has not been released up till now. And these monies have been spent. Actually, our members borrowed money to go for the training, to go for the exams, and they want to pay back. Okay, even the state tertiary health institutions, many of them are not doing well. In fact, some of the state governors are completely abandoned healthcare services in their states. You know, we can mention the states. They are not paying. We don't have up to 10 states in this country paying the medical residency training fund. Some of them are not paying the salaries. Some of them, even the salary structure they are using, we do not even know how they came about it. It is obviously lower than what is being paid at the federal level. So you have both internal and external brain drain. People move from those states to the federal. Some of them move from the states to outside the country. So we want both the federal and the state governments to work around the clock to address this demand, because incidentally, these are the things that will reduce the brain drain, the massive brain drain that we'll have in our health sector.
So who are those that you want right now to address this particular matter? I mean, because we've seen you have mentioned a number of people that had invited you to say, look, this is on the front burner for us. We saw the Speaker of the House of Representatives talk about some of your demands and how they believe that there'll be more money available right now to be able to address this. And they also made you a few promises. You also told us about the intervention of the Secretary to the Government of the Federation. Who precisely in government right now do you want to be saddled with the responsibility, saying that ministers are yet to be appointed?
I've said it before, we don't need a minister for the secular or one-for-one replacement to be released. And even the Medical Residency Training Fund, it was captured in the budget. There's no reason why it shouldn't be released at this point. Okay, and the other demand that we've made, if they sit down with us and put timelines we know that they will soon appoint ministers. If they sit down, if they're able to address these 2 issues I mentioned, and then even the issue of the upward review of the consolidated medical salary structure, there's no reason why that matter should not have been concluded by now, in line with the demands we've made of government. And so if they're able to address those ones and they sit down with us and put timelines on the other issues remaining, then we can take it to our members, and we are sure that they will listen to us and suspend the strike.
Okay, so right now, is it that I mean, all the ultimatums that you've given, they've expired, and as such, you're not exactly willing to, give any further space? Because it was just this week that the Speaker of the House of Representatives had that engagement with you.
You see, this thing is about time. It's about the speed with which the government side is responding. You remember that 2 weeks ago, this matter was tabled during the plenary session of the House of Representatives. And 2 weeks after, nothing tangible has come out from it. You see, we are representing people, and people, they are suffering. So they believe that there is a limit to, there should be a limit to how long they can wait. Let government, many of these demands, in fact, you don't even need any formal meeting for them to be addressed. So we are still appealing. This strike is just on day one. I have said that some of these issues can be addressed in a day or two, and nobody has been able to say it is not possible. Let them address them, and our members, we believe, will come back, to their duty post.
Dr. Oji, you mentioned a number of states the other time that some states are doing some things, some states are not doing some things. Which states are you, saying, okay, they're making some moves, and
Some
which
progress.
ones are not making any moves?
Well, we know that the Benue State University Teaching Hospital, they have paid them the medical residency training fund for 2023. In fact, they have paid before the federal government. We are aware that we just said that Ogun State is making efforts to pay, at least for the year. But we are also aware that the Kwara State governor, who is also the chairman of the Nigerian Governors Forum, he met us last week, and he promised to pay his people by this week. And so apart from these three states, we are not aware that there is any state again that has paid for 2023. In the past, Enugu State government paid, Delta State paid, Nasarawa paid, but for this year, it's only these three states, if I remember correctly, it's only these three states that has paid or making moves to pay.
And I, in fact, heard the Ogun State governor saying yesterday that they're also approving the implementation of payment of medical allowances to medical workers. So these states that you have mentioned, is it the demonstration of commitment towards some of your demands? Is it significant to say that perhaps the strike may not be total in these states, or the medical workers in these states may not join the strike, just to also show that they appreciate the commitment of the state governors?
Well, those are the internal decisions that we will take as the National Executive Council. But as of today, we have declared total indefinite strike, and all our member centers are expected to join.
Including in these three states?
I said again that these are internal discussions because we have a way of addressing those issues.
Yeah,
I understand where you are driving at.
Yes, I mean, those states have started, some have paid, some are making moves that So how does this strike that you're making indefinite and total, how does it help that course?
Incidentally, I hope you know that medical residency training fund is not the only demand that we are making. Many of these states have not even paid hazard allowance, which was paid from last year. Okay, so like I said, these are internal decisions that we will take as a body, and it's not for public consumption.
Okay.
We appreciate those state governors that have tried to address this issue, and we promise them that we will take it into consideration in the decisions that will be taken.
Yeah, it also sounds like, from what you said now, that it's not just at the federal level that this intervention is required. It's also at the state level. Which of these demands, 8 of which my colleague read out to you the other time, which of them are state-specific and which ones are federal?
Most of the states are not paying the medical residency training fund. Most of them have not paid the hazard allowance. Most of them have not paid skipping arrears. Most of them have not also adopted the revised consolidated medical salary structure for their doctors. So all these things have to do with the states. some of them are also, also have to do with the federal government. I have listed the issue of the circular on one-for-one replacement, the 2023 Medical Residency Training Fund, the upward review of the consolidated medical salary structure, which incidentally government started negotiations since last year, and it has become endless. We have also talked about the hazard allowance that was paid last year. So many of our members were omitted, and we have submitted the list. Even the Ministry of Health has also submitted the list, for this payment to be made. And when you have this kind of payment and some people are omitted, it causes agitation, So we are also talking about the downgrading of the membership certificate of the West African College of Surgeons and Physicians. These things have to do with the federal government. Even this one doesn't have to, doesn't require any financial commitment for it to be addressed.
Speaking of which, after your ordinary meeting some months back, you rejected the, is it 30 to 25% offer of government for the consolidated medical salary increase. Isn't that, significant? Because government has made an offer, has made a certain commitment, and perhaps government is saying that under the circumstances, the economic realities we're faced with, this is what we can offer.
Is it our members that will bear that economic reality? Because the truth is that what we are asking for is full salary restoration. What that means is that the salary structure we are using now was approved in 2009 and implemented in 2014. We know what the inflation rate was as at then, the exchange rate, the fuel price even, compared to 2023. So we have applied all those figures and gotten a certain percentage. And some Nigerians are saying it is too much. How did we come about it? We have placed the data on the table. Let the government side apply the figure, because what we are saying is that increase this salary to take us back to our economic status in 2014. So essentially, it is not even an increment. With the removal of the fuel subsidy, the figure we are getting is over 500%. And up till now, government has not done their own calculation.
So of the 200% that you're demanding, what's the minimum that you can accept if negotiations were to resume?
When negotiations start, because you see, it is difficult for me to make a pronouncement. These are things that when government makes the offer, we'll take it to our National Executive Council to decide, but certainly not 25% or 35%, because the issue is that how did you come about that percentage? It is not going to, remember that we are all trying to address brain drain in the health sector. And we have said that the most important cause of this brain drain is poor remuneration. So if government is offering something that will not increase this salary to the extent that it will take us back to where we are in terms of our purchasing ability when the salary was approved, you will not address brain drain. People will continue to live. And I believe that this government wants to address brain drain. And if that is so, they should work with us to increase this salary to a significant level that we can use it to keep our doctors and nurses. Because it's not just about doctors. All the clinical staff in the hospital, they're asking about dissenting. It's not only doctors that are leaving.
Well, how do you respond to those who say, give these governments a bit of chance, give them some time to adjust? I mean, the ministers, the cabinet is not even formed yet. How do you respond to those who say that, especially at the federal level? In the same vein, how do you engage with the state governments? And there are those who would also say a good number of them are just getting into office. Why not give them a little bit of time to adjust?
Yeah, we are willing to give them time. Our members are willing to give time. But they at least have to address the urgent demands that we have on the table, which I have said. And I'm sure they have the capacity to do that. I'm sure they can do this thing within this week if they want to resolve this problem. Once they do it, we will appeal to our members, and I'm sure they will listen to us. We will come back to work while we give them time to address demands.
But don't forget that some of these things have to do with money, and consequently, any government will be very, very wary of making commitments it cannot sustain. Yes, I mean, you said it's almost 20 years since 2009 that these things have been on. But at the same time, one would have to consider that, look, these are economic issues. I mean, it's not just recruit the doctors and then let them just languish. You want to consider that when you recruit these doctors into office, you want to make sure that they have the right facilities to work with. You want to make sure that they get the correct remuneration, including their pensions and all those things. And given the question Bukola asked you the other time about economic realities, don't you think it needs much deeper thinking?
2023 Medical Residency Training Fund was captured in the budget. There's no reason why it should not be paid by now. The issue of one-for-one replacement, like I said, does not cost the government anything extra, because what it simply means, like as I'm seated here, I know the doctors that have left my hospital. It's just for the chief medical directors to use the policy to replace them, to fill in the gaps. So what extra cost will it cost? Are they saying that even when those people have left, that they are still spending the money to pay their salaries to who now? So it's simply a measure to replace those that have left. It won't cost them extra payment. Now, the downgrading of the membership certificate we talked about is not an economic issue. It won't take the government extra. You see, we believe that what government should do when you have this kind of issue is to quickly identify the demands that will not even cost you much, that are urgent, and address them. It's only if they do that and we refuse to come back, then of course it will be said that maybe we are not willing to listen. But they have not even addressed those ones. And so it is difficult to talk to our members not to go on strike. We have tried everything we can to avoid this strike, to the extent that we issued another ultimatum. It expired on Tuesday last week. People were calling us from everywhere, from all over the country, that we should proceed on this strike on Wednesday. The national officer just managed to control the situation, extended it to Friday. We had our meeting. People were so angry. We couldn't end that meeting on Friday because of the anger and because of the stress that people have gone through. We had to go on a recess, still giving more time to see whether the urgent demands can be addressed.
And following the intervention by the Speaker of the House of Representatives, have any government officials made overtures to you, in form of appeal, that you at least wait until the cabinet is constituted?
Well, I want to repeat that some of these demands, you do not need to constitute the cabinet for them to be addressed. We are aware that there is a proposed meeting still in the House of Rep by tomorrow to still discuss these issues. But in having that meeting, we'll keep saying that the urgent demands that we've made, our members are saying that they should be addressed before we continue other discussion. We are available. We are going to attend all the meetings, even though we know that some of them, like the ones we've attended in the past, not the recent past, you go there and even from the beginning of the meeting, it is obvious to you that this meeting is not going to achieve anything. Because when you call a meeting, you do not bring the relevant government agencies that we have to speak on the specific demands on the table. How do you hope to address the issue? When you get to those demands, they will simply tell you that the particular government agency that should address it has not been invited. So how do you make progress?
So how do you respond to those who say, you are a member of the NMA, your association is it's an affiliate member of the NMA. What's the NMA saying in all of these?
Well, I think NMA is in a better position to address that question. But I know that the NMA is apparently, they are fully aware what we are doing. We have carried them along all the way.
And I recall, that reminds me also, Ayo, that under the last administration, that was a bone of contention with the former Minister of Labor, who, projected that you're not the ideal body to initiate this negotiation. When government now begins to, address your demands, I hope it would not resurface, with a form of rivalry between you and the enemy.
There can never be rivalry between a father and his son. There shouldn't be. There is no rivalry in between NMA and NARD. There has never been. Because even that situation you referred to, you didn't bring NMA to discuss with them to tell you their opinion. And so I want to maintain that NMA is our father. They are fully aware of what we are doing. And they have not said that they are not with us.
They are aware, but they are not involved right now.
What do you mean by being involved?
Involved with your negotiation right now?
No, they are. So many of the meetings we have attended, they were there.
Okay. Perhaps, the remuneration and, all of those things for your members, is one. But perhaps you can help Nigerians understand the real practical hands-on situation or experience that your members go through. What's the average day of a Nigerian doctor like? Maybe you want to give your own example as an orthopedic and trauma surgeon. I assume that that's what you are.
Yeah, you're right. You see, as a doctor, you walk around the clock. And I'm sure people already know that there is no breathing space for you. You are expected to attend to your patients all the time, whether you are in the hospital or not. And that is why most of the time as a doctor, you always try to make yourself to be reachable. You go to work every day. You take your course. You see emergency cases. Okay, so it is more of working 24 hours, and it has been complicated by the fact that we don't have enough hands already in the hospital. Some departments are shutting down. I can tell you there are some first-class tertiary hospitals, federal tertiary hospitals in this country that even as at 2 months ago, they advertised for 500 doctors. The people that applied were less than 200. And so what we are talking about is an emergency. And that's why our members feel that they don't understand why government is not moving as fast as they should on this matter. Would they rather wait until everybody leaves?
Interesting that you cited this example, because this is about the same question Bukola asked you the other time, that do we even have enough doctors in Nigeria to respond to any employment or recruitment? But you just corroborated it one way or the other now.
And so that's why they have to move fast. Even with this demand of salary, so many of our people outside the country, in fact, they have even told me a just slightly lower percentage from what we're asking, that even if government gives that they will come back.
Okay.
And so we believe that government should work on it, because this is an emergency. And we want to appeal to Nigerians, because this struggle is for them. We want them to be able to see their doctors and their nurses when they get to the hospitals.
Okay. Dr. Innocent Oji, National President, Nigerian Association of Resident Doctors and Senior Registrar, Orthopedic and Trauma Surgery, thank you so much for your time today, and we hope this is resolved very, very soon.
Amen.
Thank you.
Okay. So we're back in a moment to take on another issue. Do stay with us.